Hey everyone, I'm Davis, and today my presentation will be on the vessels of the head and neck and their palpations, pressure points, and punctures. And so at the outset, I'll spend a little bit of time talking about the major vessels of the head and neck. Okay, so the common carotid arteries are the main entrance for blood into the neck and skull, and the right common carotid artery branches from the brachiocephalic or innominate artery, whereas the left common carotid artery branches directly from the arch of the aorta. And the common carotid arteries branch into the internal and external carotid arteries at the carotid bifurcation on each side of the neck. Okay, so the external carotid artery and its branches are the primary supply of blood for the face. And it's usually thought of in four groups. And so the anterior group includes the facial artery, the superior thyroid artery, and the lingual artery. The medial group includes the ascending pharyngeal artery. The posterior group includes the occipital artery as well as the posterior articular artery. And the terminal group includes the maxillary artery as well as the superficial temporal artery. And those four groups are visible in that top left figure. Okay, the internal carotid artery supplies blood to the brain, but it also branches to supply blood to the orbitals as well as the upper nasal structure. And so the internal carotid branches into the ophthalmic artery, which divides again into two groups, the ocular and orbital groups. And so the ocular group supplies the eye and its ciliary muscles, whereas the orbital group supplies blood to the other orbital structures. Okay, so the internal, external, and anterior jugular veins are the primary way that blood drains from the head and neck back into central circulation. And so the anterior jugular vein drains blood from the neck and the superficial structures of the face. The interior jugular drains blood from the brain and interior surface of the face. And the external jugular vein drains blood from the superficial structures of the skull. Okay, now I can talk a little bit about the clinical importance of the major vessels. And so the palpation of the carotid artery is where I'll begin with. And so this is a unique diagnostic tool because the carotid is a particularly accessible large artery, and palpation of the artery is visible in that top figure. And this can help distinguish between different types of valvular heart disease, and it can also be used to give insight into the left ventricular systolic function. And as you can see in the bottom picture, osculation of the carotid can also help to identify atherosclerosis in that region. Okay, venous examination of the neck is a little more common than palpation of the carotid artery, and its primary use is to determine jugular vein pressure. And as you can see in that top picture, the clinician here is pointing out the visible neck vein on this patient lying in a reclined position, which is where the vein is usually visible. And the way this works is the clinician will map the waveform of the pulse of the neck veins to determine abnormalities. And you can see an example of a normal waveform in the bottom of this slide. And so an extended A wave could be an indication of pulmonary hypertension or tricuspid stenosis, as this would be caused by strained right atrial emptying. There's also a Cannon A wave abnormality, which is caused by the atrium contracting against a blocked tricuspid valve, and this could be an indication of complete AV block or ventricular tachycardia. There could also be an absent A wave, which is common with AFib, or there could be an elevated V wave, which is an indication of tricuspid regurgitation. And there are also two other visible signs, Kosmol's sign and Friedrich's sign. And so Kosmol's sign is when the neck veins rise upon inspiration, which is the opposite of normal. Normally, the neck veins rise upon exhalation. And so if this is happening, this is a sign that the right heart is failing or that there is cardiac tamponade. There's also Friedrich's sign, and this is an exaggerated X wave or a visible collapse of the vein during diastole, and this is a sign of constrictive pericarditis. Okay, so now I'll move on to some venous punctures, and so the main reason that you would want to puncture the veins of the neck for clinical purposes would be for internal jugular vein catheterization or central line placement. And the reason that you would do this is for IV infusions, monitoring of the central venous pressure, hemodialysis, insertion of cardiac pacemakers, or the insertion of the inferior vena cava filter during surgery. And this is done to catch blood clots during a surgical operation. And placement of these jugular vines are usually guided with ultrasound because manual insertion can lead to inadvertent carotid punctures, as you'll see later on, and this is extremely dangerous and can be fatal. So, arterial punctures, really the only clinical reason that you would puncture the arterial vessels of the neck is for carotid angioplasty and stenting. And so this angioplasty and stenting is visible in the top figure, where you can see that the artery has plaque and atherosclerosis, and so a stent has been placed to allow blood to travel through the vessel normally. And so this is done to prevent or treat strokes, but it is done rarely because there's an extremely high risk of stroke and death during the procedure. And so in this bottom picture, you can actually see a dissection of the neck during surgery. And what happened in this case was that the central venous catheter, which is the little white structure in the dissection, actually went through the internal jugular vein and into the carotid artery, which is extremely dangerous. And so surgeons had to go in and repair both of those vessels. Okay, there are a few pressure points of the head and neck, which are common in traditional Chinese medicine, and they reflect the acupressure points used in acupuncture. And the points relevant to the head and neck are commonly used to treat headaches and relieve sinus pressure. And so you can see on the right is the B2 pressure point, which is used to relieve eye strain and sinus pressure. In the left, there's GB20, which is used to relieve headaches caused by neck tension. In the middle, you can see GV24.5, which is used to relieve eye strain and sinus pressure. There's LI20, which is near the maxillary sinus, which is used to relieve sinus pressure. And there's EXHN5, which is near the temple and used to treat eye strain and headaches. And I was able to find several small cohort studies that showed improvement of headache pain from massage in this area. And this is kind of intuitive because, as you can see, GV24.5 and B2 both kind of straddle the frontal sinus, and so it makes sense that if you put pressure in that area, this could relieve some pressure from that area. Okay, here are my references.